Hi, and welcome to City Happenings. I'm Mayor David Black. Papillion continues to grow and offers much to its residents so they can live, work, and play. For more about Papillion, here's City Happenings.
Thanks, Mayor Black. Public Works Director Jeff Thompson takes a look at how current and future technology affects work that is done.
There's always room to improve in efficiencies, especially as technology grows and things become a lot more computerized. Certainly, I don't think we'll have autonomous snow removal equipment or anything like that, but, I think, there will be technologies that we'll be able to utilize, now and moving forward that will help us better serve the citizens.
Thompson says snow removal is just one of the areas.
Different products for, pothole repairs and, trying to find more efficient electronics for our water system to cut down on power consumption and things like that. So I think it's just a matter of fine-tuning things.
New technology is great, but Public Works is still Public Works.
We've been doing it for hundreds of years this way, but things, gradually change with technologies and things get more efficient and cost effective, and I think that's really going to be our goal and strategy in Public Works moving forward is trying to streamline some of that kind of stuff with technology.
No matter how you slice it, excellent customer service is a priority.
Maintaining the highest level of service to the public that we possibly can. I don't think people understand a lot of what we do and a lot of what goes into it.
Having a great culture for the Public Works staff is key.
We have a great staff now. I mean, the guys are by far top-notch. Wouldn't trade them for anything. So, just providing a high quality of service. I think everybody that's in this industry, for the most part, isn't in it for the money. They're in it for the public service, and I think we all strive to provide the highest quality service we can for the public.
The local hospital, CHI Midlands, is part of a community benefit program that provides medical care for uninsured or underinsured residents in Papillion and Sarpy County. Given the current medical insurance climate, it takes some juggling to meet community needs.
We have to look at duplications of services. We have to look at where care is provided and if it's the most cost effective. And as you pointed out, we don't get reimbursed for every dollar that we put out there. If you look at the federal government, for every dollar that we bill the federal government, we might get 26 cents back on that dollar. And then when you look at commercial payers, we may charge a commercial payer $1 and we may get 70 cents on the dollar. And so somewhere there we're still not covering the full cost. And so while you see us starting to transform ourselves in the community, we are putting our centers of excellence and our hubs across the metro area.
Miller uses Creighton University as an example.
Combining our new facility with Bergen, so now it's Creighton University at Bergen Mercy, but then also opening up a state-of-the-art community health center down on 30th Street to really actually meet all the needs of that community as well.
Popular thought is to build more facilities. Miller explains why not to do that.
We already have so many beds, in the community that will never fill those, and so really we need to try to get, to my opinion, upstream on the healthcare issues and really promoting healthier living, diet, exercise, being able to medically managers. Because the last thing you want to do is come to the hospital, for your care, and so that's why you start to see a lot of these other services throughout the organization.
Cost effectiveness also leads to innovation.
We're on the leading edge of using telemedicine because believe it or not, there's probably not enough providers to go around, especially specialty providers. And so as we promote our telemedicine, especially out into the other rural communities, it's a very cost-effective way of providing care to specialists that they may never have access to.
Providing free health care for those who can't afford it is part of what CHI does. Publicizing it is not what CHI does.
I do believe in the past we haven't told our story as well as we could. You're not going to see us put up billboards of the community benefit. It's just not going to happen. It's just something that is innate in our mission, that's faith-based, that we've always provided to the community.
It was Mayor Black who pushed CHI to tell the public about the community benefit program.
We try to give this out in our community meetings when we're out in the public, and just to remind them this is what This is what CHI is about, and it's all mission based. We're here to serve the community, we're here to serve the ministry of Jesus Christ, and that's what our goal is. And so we do give away or subsidize a lot of the care that people can't afford to pay, and we've actually increased that this last year. We made our charity care policy even more robust so we could capture more patients and more people that can't pay or afford health care.
Last fiscal year, 1,238 patients were helped at a cost of more than $2.7 million. A local high school senior is preparing for the U.S. Military Academy this fall. She says she's ready for the discipline and structure that the academy demands and doles out.
I've experienced the yelling part, sports-wise. Got yelled at quite a few times. So I'm not nervous about that. It's just, I'm nervous for something brand new, something I haven't experienced before.
While not yet choosing a major, she's always been interested in science. She attends the Papillion La Vista School's Health Academy.
We take half of our classes at the high school and half is at the hospital. And so we go on rotations and everything and find out what we want to do. So I know for sure it's somewhere in the medical field, and an orthodontist is a general idea I'd like to go, but I kind of want to see where my gen eds in college take me.
Along with the discipline and academic elements, there's the military training.
I'm excited to learn the new leadership role. I'm just not 100% sure where I'll end up after basic training, So I don't know if I'm going to be out there in infantry or if I'm going to be stationed somewhere else,
That's what's happening around Papillion. There are lots of ways to stay up to date with what's happening. You can find us on Facebook, follow the City of Papillion on Twitter, or even watch our YouTube channel. And of course, information about all of our departments and programs is available on our website, www.papillion.org. For more information, go to papillion.org or just call the Mayor's Hotline at 402-827-1111. Thanks for watching.